There was a lot that I learned when completing this project over the course of this semester. For example, I learned that when you are writing or verbally communicating to a group of people, it is important that you address the audience in an appropriate manner. You need to make sure that you, as the writer, are aware of the cultural background, the educational background, and the background on the audience as a whole, so you yourself know how to address them, how to appropriately go about educating them if you are doing that in your message, and just so there are no miscommunications that can happen throughout the message that you're portraying to them. For future portfolio projects, I think it'll be very beneficial for me to get more information on my topic from different sources. For example, on this portfolio project, my topic was nurses and their mental health, and if hospitals or any other healthcare facility are doing anything about that. I think it would have been awesome if I was able to go to a healthcare facility or hospital and interview nurses and see firsthand what they are experiencing and what they go through on a daily basis, and to see if their mental health varies because of their workload stress or different factors that can affect their mental health. This portfolio project touched base on many of the course and institutional outcomes. One of the course outcomes that this portfolio project reflected was analyze situations, audiences, and desired goals to determine the written format appropriate to the purpose of the message. This was done in the beginning of the project when we first decided our topic of research and who the audience we wanted to direct this research to. The second course outcome was create written communications that promote positive, interpersonal, intercultural, organizational, or international relations. This was done again when we chose our topic and making sure that we addressed the audience appropriately, and we used inclusive language in different styles of writing that was easy enough for everyone of every culture to read and understand. A third course outcome was to analyze, evaluate, and synthesize research through various documentation approaches that include paraphrasing, summarizing, and directly quoting sources. We accomplished this by finding resources on the virtual library and implementing them into our message to help strengthen and give better knowledge to the audience about how important our message is. There are a lot of the institutional outcomes that this project touched base on, one of them being the information literacy and communication. This was met by us using the virtual library to find our resources and implementing them into our written communication to state our findings and to strengthen our message to our audience. Another outcome was thinking abilities. We did this by using feedback provided by our peers and instructor to help strengthen our writing. We also accomplished this by giving feedback to our peers on their rough draft of this project to help them strengthen their writing and to overall make a more positive working environment for us. Another institutional outcome we met was community and career. While doing this, we did many discussion forums, and I learned about many of the nurses and what they've experienced in all the different healthcare facilities and things that go on that aren't necessarily just. And when doing this kind of helped me create my topic of nurses and their mental health. And I think that it is important to understand these problems that can arise within your choice of career and how to address them in an appropriate manner, and hopefully be able to evolve the institution that you work at to help make a better working environment for you and for all your colleagues. Technology literacy is an important workplace capability. Technology literacy is your ability to effectively use technology to gather and evaluate information so you can enhance your learning capabilities through problem solving and critical thinking. This should be done on an everyday basis in the workplace because you are bound to come into problems where you're not going to know the answer right away, and you're going to need to do your best to find information to prove a point or to help disprove a point to help your workplace become more efficient and more effective. Out of all the workplace capabilities, I think that communication is one of the most important. I think that it is important to use because you must appropriately address your audience and make sure that your tone is appropriate for the audience you are conveying your message to. And you want to make sure that you are clear and concise and have proper information so your message can't be misinterpreted or miscommunicated. In the nursing field, it is important to properly talk to patients and make sure that they are aware of what procedures they are having, what medications they are on, and making sure that they know exactly why they are doing that procedure, why they are taking that medication, because if they don't, then you are not doing your job as a nurse and as an educator and a communicator to them.